Joining us now is Dr. Afua Intem-Mensah from Faith Regional Health Services in Norfolk, Dr. John Trapp from Bryan Health in Lincoln, and via Zoom, Dr. Mark Rupp from the Nebraska Medical Center in Omaha. Thank you all very much for joining us. And before we get too far into specifics, I do want to ask all of you about your thoughts on the current state of the pandemic. Dr. Mensah, let's start with you. How do you think the state is doing in terms of COVID?
I like to say that I remember when I first came here in April, our vaccination rate was around 41%. But right now, fully vaccinated people in Nebraska stands around 65%. And people who have received at least one dose stands at 71%. I took some time to go through the state data, and I realized that vaccination is pretty much concentrated in some jurisdictions in Nebraska, mainly in Lincoln, Lancaster region, Sarpy County, and also in Douglas County. And that's pretty with your vaccination rates around 67 to about 70%. And in my county, Madison County, we're around 53%. In a lot of small counties in Nebraska, western Nebraska, all over the Panhandle, you have vaccination rates as low as 24%. So we pretty much have a long way to go. As many people can get vaccinated as possible, that will go a long way in kind of stopping people from being so ill and ending up in the hospital.
Dr. Rupp, what are your initial thoughts on where we stand right now?
Well, I think we're at a very critical juncture with very rough and dark days ahead of us for the next probably 4 to 6 weeks. The Omicron variant is coming on gangbusters. The numbers are rising logarithmically. The number of cases is undoubtedly an underestimate because so many people are not getting tested or having the home test kits that are not reported. And although Omicron appears to be somewhat less likely to cause severe disease, the sheer numbers of cases are putting a very, very heavy stress on the healthcare system.
And Dr. Trapp, I want to get your initial thoughts as well, but also as a pulmonologist who's focused on the lungs, does the Omicron variant provide less of an attack on the lungs than we saw with Delta?
Well, boy, just thinking about the past 2 years that we've been dealing with this, it's been a real roller coaster ride, and it's been challenging on the workforce. It's been challenging on patients and what the hospitals have been able to do. Just as we get through the Delta variant, which has had a dramatic impact on patients, particularly the unvaccinated, higher levels of illness, ICU stays, that's been really challenging from a pulmonary critical care perspective. And now, as Dr. Rupp has said, we're transitioning to a different variant that's very fast spreading and is going to spike here in Nebraska in the next few weeks. So all of this impacts the lungs, commonly presents with respiratory symptoms. The challenge right now is we're also starting to rise up in influenza. So very difficult to differentiate those the two illnesses. Both present with mild cough, nasal congestion, aches, pains, and low-grade temperature. So very common symptoms, difficult to say whether you have COVID or influenza. And that's some of the challenges that we're seeing in primary care and our emergency department as well.
And as you've all referenced, Omicron is driving another wave of cases in Nebraska. According to CDC data, COVID cases are up 72% over the last 2 weeks. Right now, that's about 1,800 cases per day, and that's nowhere near where the state was during the peak in late 2020. The country as a whole, though, is way above its previous peaks, and so is it inevitable that Nebraska will also exceed its previous high in cases? And Dr. Rupp, you've already said that we've got dark days ahead.
Yeah, I completely think that we're going to break those records with regard to the number of cases. I guess, hopefully we won't see quite the level of hospitalization, but the hospitals are already under extreme duress, caring for all the patients that we normally need to care for. As was already related, in addition to that, we're seeing influenza season that is more reminiscent of a normal season, which is, again, putting additional patients into our emergency departments, clinics, and into the hospital. I think we're in some pretty tough times.
And Dr. Rupp, we've heard nationwide about some of the co-infections between influenza and COVID in other states. Have you heard of any of those types of infections in Nebraska?
Yeah, we have seen a handful of dual infections with COVID-19 as well as influenza or other respiratory viruses. We knew early on that this could happen because the COVID pandemic first started during the flu season. So we did see some of those cases in China and here in the United States in the initial months of the pandemic. Last year, we luckily had essentially no influenza, largely, I think, because of viral dynamics with the COVID-19 outcompeting other respiratory viruses. And undoubtedly, some of the effects that we had with our non-pharmacologic interventions of distancing, masking, trying to avoid risky settings, those sorts of things, undoubtedly prevented the spread of other respiratory viruses in addition to COVID-19. I don't think we're going to get that lucky again this year, and we're going to see both flu and this Omicron variant spreading wildly.
Dr. Trapp, I want to ask you, most are reporting that the Omicron variant is less severe than Delta. Is that what you're seeing in your hospital?
Well, certainly we're not seeing an increase in the ICU cases that we had seen with the Delta variant. We still are seeing people become ill. Even people who are vaccinated have risk for Omicron variant. We do see patients who require hospitalization, particularly concerned with our immunocompromised patients who can develop severe illness. So it does appear that there is less severity with regard to need for intensive care services, mechanical ventilation, and death with the Omicron variant. But the concern is really that we're seeing this spike at the same time that hospitals are at capacity. So where we're seeing real critical concerns are with patients with other acute medical illnesses, stroke, heart attack, trauma, that are having difficulty accessing critical care services and specialty services at this time.
And you talked about hospitalizations. From the state level, hospitalizations aren't as bad yet or growing as rapidly as the cases are. As of yesterday, 533 Nebraskans were hospitalized with COVID. That got to be almost 1,000 back in 2020 during the peak. But I want to ask you, Dr. Mensah, can we conclude from our current numbers, as we've been talking about, that Omicron is a variant that is definitely more transmissible, but maybe not quite as severe when we're talking about the effects?
I think we are getting a bit ahead of ourselves because we haven't hit our peak with Omicron just yet. You know, yesterday on the state call, we were made aware that Omicron was dominant in Nebraska, but I think we are going to see more cases. We haven't hit our peak at all. So it's a bit too early to just say that, you know, it's going to be less severe. It's not going to overwhelm our hospital systems. We need to give this a bit more time. And as Dr. Rapp rightly said, the next 4 to 6 weeks would definitely determine how Nebraska would do with Omicron. I always say something. Right now, I feel as if I'm standing at the seashore and there's a calm before the storm. The storm is coming. I don't know when it's going to show up, but we all just have to be prepared because Omicron is going to cause increase in hospitalizations. If you look around the whole of the United States, hospitalizations have gone up all over the states, which have really high vaccination rates, places where you have less people who are not vaccinated. So I just don't know how it's going to pan out in Nebraska just yet. So we just have to kind of watch and wait. And for me, I think what we have to tell people now is that they need to go out to get vaccinated as soon as possible. If you haven't received your booster, you need to go out and get your booster now. You need to be prepared for this.
So, Dr. Trapp, if we go along with that analogy, that storm that is coming, if we're looking for a metric that can really measure the intensity of that storm, should it be hospitalizations as opposed to total number of cases?
Well, I think total number of cases is important. It requires a lot of supplies, whether it's testing. There's a desire to receive treatment, even with moderate levels of illness. And I think that just raises concerns with, the end impact of that, of how it impacts hospitalization, people's lives, employment. We're very concerned with how this might impact hospital staffing, where even mild illness takes people out of their usual workday to be able to care for patients. One area where we have expressed concern is in pediatric cases and hospitalizations that we've seen in other areas of the country, concerned about that coming to Nebraska, again, with limited capacity for pediatric hospitalizations and pediatric beds.
And I want to talk more about that because hospitals have been crowded in the past months, and that appears to have eased a little bit with adult beds. According to state data, more than 20% of regular adult beds are available. But for children, as Dr. Trapp mentioned, it's gotten worse. From the last days of 2021, pediatric beds have been overflowing, more than 100% full. And so, Dr. Rupp, I want to ask you a little bit about what you're seeing at your hospital when it comes to children in the new surge.
Yeah, so most of the sick children here in the community are taken care of in our specialty children's hospital. They have noted an increased number of admissions. As has already been related, this has been seen in other states. I anticipate that we'll continue to see this trend here in our Nebraska communities. Unfortunately, we just don't have a lot of capacity in the pediatric age group. These are small facilities with a limited ability to flex upward. So I think just like I've said in our adult hospitals, we're going to be under a lot of stress.
Right now, more than 2,400 Nebraskans are getting a vaccine each day. During December, many were getting boosters, so the numbers surpassed 4,300. They've since fallen off a little bit, but in all, the state is about 65% fully vaccinated. So, Dr. Trapp, have we reached a point where everyone who is going to get vaccinated has gotten the shot?
Well, I sure hope not. I'd love to think that as people see this continue to go on, that the value of vaccination as our primary prevention is again emphasized. As has been said, vaccination is important. It's inexpensive compared to the other therapies and hospitalization that's out there. It's widely available. And it's not just primary vaccination, but it's getting boosted as well. Right now, we're strongly recommended a third vaccine. That's continued to expand with lower age groups. I think that's really important to emphasize. Allowing vaccination for younger age groups to begin is also very important. So if you've not been vaccinated, again, it should be emphasized that vaccination is our primary prevention therapy.
So while we're discussing this, there will also be some people that have said, hey, let's again think about herd immunity. Phil Mickelson, a famous golfer, asked on Twitter before the holiday break, serious question, since I'm not a doctor, he says, if Omicron is contagious but not deadly, why try and control it? Why not let it go and let people get it and develop immunity, especially for those who won't get vaccinated? So, Dr. Mensah, you're smiling. I want to ask you to respond to Phil Mickelson on that.
Well, the beautiful thing about the COVID virus is that you just don't know how your body is going to react to it. I always give a big breakdown to my patients about COVID. First, you have the viral infection, and after the viral infection, you have this immune response. And every individual responds differently. Some people have an immune overdrive, and it's an immune overdrive which will end them up in the hospital and likely for Dr. Trapp to be taking care of them. So for me, I don't think it's a good idea to just think of it that, oh yes, we are heading towards herd immunity. And with herd immunity, because Omicron is less severe, everybody's going to do well. I'll beg to differ. A lot of the news that we are hearing are coming from countries where, so I'll take for example South Africa. So South Africa, the number of cases that they are seeing there are in people who have already had COVID. Some people have already had COVID with the previous Beta variant and also the Delta variant, and most of them are young. So you are seeing a much younger population, and you cannot translate what happens in a much younger population to an older population, which is unvaccinated. And you also look at the case of United Kingdom. Majority of the people who are getting COVID again now are vaccinated, so they do have some antibodies. They have antibodies, so the likelihood of them being sick and ending up in the hospital is way less as compared to an unvaccinated older population for which a lot of Nebraskans make up of. So, and what we are seeing right now in our Nebraska hospitals is that you have people within the ages of 30 to 40s filling up our ICUs who are unvaccinated. So you can't really equate herd immunity. You may be able to talk about herd immunity in some areas within Nebraska, but where you have such low vaccination rates in western Nebraska, even around where I'm coming from, northeast Nebraska, where you have vaccination rates around 30%, 24%, there's no way we are heading towards herd immunity.
As we kind of wind up our time a little bit, I want to get some quick thoughts on you on what the future holds. And we've already heard that it could be some dark times ahead. But the New York Times has reported that 6 national healthcare experts who formerly advised President Biden before he became president they've come out publicly and urged him to take an entire new pandemic strategy, one that focuses on the new normal of living with the virus indefinitely and not wiping it out. So I kind of want to get your thoughts on the strategy that we're taking right now. Is it the right one, or should we be shifting and realizing that this virus in one form or another is going to be with us for a while? And we'll get some quick thoughts. Dr. Rupp, we'll start with you.
Yeah, thank you. So undoubtedly, this virus is not going to just magically disappear, and we are going to continue to see it in some guise. I think that we will be transitioning from an epidemic form of illness to an endemic form of illness over time. And I guess I have some hope that this Omicron spike, because it is just absolutely so contagious, so transmissible, that a very broad swath of the population will gather, disease-induced immunity, which actually may help us to transition to more of an endemic state. But I would absolutely echo the comments of the other commentators, Dr. Trapp and Dr. Mesa, that, our best bet is to gain immunity through vaccination. And the vaccine continues to show very good levels of protection against severe disease, hospitalization, and death. And getting immunity through disease is really a crapshoot. And you just don't know if you're going to get severe disease, death, or the long hauler syndrome. You'd be much better off getting immunity through immunization.
Dr. Trapp, your thoughts on what we should be doing in the future?
Well, I think vaccination remains important. The longer we allow this virus to circulate in the host population, the assumption is it won't change. We've seen it change multiple times, and it may change again. So that raises the risk that another variant comes out that is more aggressive, more deadly, and trying to minimize that impact by vaccination is a much better strategy than allowing the disease to progress. So,
Dr. Mensah, we've got about a minute left or so. So give us what you think.
I would say vaccination, 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 and for people to go ahead to get their boosters. If you realize that you're immunocompromised, or you've ever been told that you're immunocompromised, please wear a mask, whether you're vaccinated or if you've had your boosters. It's very important. And I think the most other important thing is that the rich world has to start looking at vaccine equity. So this vaccine came from South Africa, where only about 32% of the population is vaccinated right now. In my home country of Ghana, only about 18% of the total population is vaccinated. We have to start thinking about vaccine equity, because once you get vaccinated and the rest of the world is not vaccinated, what's going to happen is that you have a new variant which will probably come over to your vaccinated country and cause a new pandemic. So I think vaccine equity is something that the rest of the world has to start looking at. Thank you.
Yeah, so much to talk about and so much we didn't get to, but I do want to thank all of our guests for being with us here tonight. Dr. Afua Ntem-Mensah, Dr. John Trapp, and Dr. Mark Rupp. Thank you all for being with us here tonight on Speaking of Nebraska.
Thank you.
Thank you.
This interview and tonight's program are available on our website. Just go to nebraskapublicmedia.org/Speaking of Nebraska. You can join the conversation on social media. Find us on Facebook and Twitter at Nebraska Public Media News.